Hello, good evening. I'm Dr. Nikhil. Today we celebrate World Kidney Day 2023, and we'll have a short session today on how to prevent kidney diseases. So, I've made a question answer format based upon what our patients usually ask us during our OPD, during our IPD. So, we'll just go through that. So, the first question that they usually ask, what are the causes of kidney diseases? The most common cause of kidney disease is in India is long-standing diabetes and accounts for around 40 to 50% of all patients with chronic kidney disease. There are other causes as well, like long-standing stone disease, certain autoimmune disorders, and sometimes the kidney disease can even be genetic. It may be passed on from family members, like polycystic kidney disease. Sometimes even pregnant ladies can also develop kidney diseases and have raised blood pressures and sugars during pregnancy. This can have a harmful effect on both the mother and the child. Apart from these, poor lifestyle choices like sedentary lifestyle, consuming processed food, etc., are also harmful for the kidneys. Use of over the counter drugs like painkillers can also lead to permanent damage to the kidneys. So, what can be done to monitor diabetes, blood pressure? So, ideally, all patients with diabetes and hypertension should regularly check their blood sugar levels, their blood pressures. Simple methods like using a handheld glucometer can help measure the blood glucose levels, and a glucometer just costs around 500 to 750 rupees. Similarly, blood pressure can be monitored at home as well with the help of automated BP instruments, and they also cost around 900 to 1500 rupees, which is even less than the cost of a smartphone device in today's world. Both blood pressures and sugars have an important impact in kidney diseases, as both uncontrolled sugars and high blood pressures lead to progressive kidney disease. And so, keeping a check on both helps avoid or delay dialysis in most patients. Apart from blood pressure and sugar monitoring, patients should also get HbA1c checked, those who are diabetic. This will give us an idea about the blood sugar control in the past 3 months, and target HbA1c in most diabetics should be considered to be less than 7%. Diabetics should consider for an annual eye examination to look for changes of diabetes on the retina. Retina is a thin membrane on the back of the eye which helps transmit images to the brain. If diabetic retinopathy occurs and remains unchecked, it can lead to painless loss of vision. Diabetics should also take care of the feet and examine them for any cracks, infections, ulcers, or wounds. The next question that our patients usually ask is, what are the symptoms of kidney disease and how to catch them? We should all understand that kidney diseases can remain silent for a long time. Sometimes it may be incidentally detected when patients have high blood pressure and on evaluation are found to have kidney dysfunction. Apart from this, patients can have other symptoms like swelling over lower limbs, some swelling over the face. They can also see some change in the color or frequency of urine. Urine can become more frothy or foamy, and sometimes they can also give history of passing dark colored urine as well. In advanced kidney disease, patient may have symptoms of loss of appetite, nausea, vomiting, or pain along the flanks. Sometimes they can even have seizures. They should consult a nephrologist if any of these symptoms are present. What tests should we do then? Ideally, basic blood tests such as serum creatinine or a urine analysis can pick up kidney diseases at an early stage. After consulting your doctor and physician, medications can be started to delay the progression of the kidney diseases. Sometimes additional tests may be needed depending upon the type of the disease. For example, an ultrasound may be needed to check the sizes of the kidneys and ureters. The next question that we are commonly asked is, what diet should we use to prevent kidney disease? The diet to prevent kidney disease should consist of low in phosphorus. That means soft drinks and dry fruits should be restricted. In patients with chronic kidney disease, the ability to eliminate potassium from the body decreases, and so a low potassium diet is advisable. Potassium containing foods like citrus fruits, oranges, lemons, bananas, coconut water, leafy vegetable, tomatoes is usually restricted in advanced stages of chronic kidney disease as it may otherwise cause a rise in the potassium, and if the blood potassium levels are very high, they can cause even the heart to stop. Apart from this, salt restriction is absolutely essential because salt has been implicated in uncontrolled hypertension. So, doctor, what about water intake? Usually, water intake is restricted for those with advanced stages of chronic kidney disease or those with significant swelling over the feet and the ankle. So, what are the treatment options of chronic kidney disease? Usually, chronic kidney disease goes through 5 stages. Stage 1 is the earliest stage, followed by stage 2, 3, 4, and 5. 5 is where is an advanced stage of kidney damage, and for this stage 5, only dialysis and transplant are the two options that are available. If kidney diseases are detected at an earlier stage, stage 1 and 2, then if effective medications are started, we can halt the progression of the disease. So, how to delay the progression of the kidney disease? First of all, follow your nephrologist's advice. As I just mentioned, blood pressure and sugar control are the most important. The main way to keep your creatinine stable is blood pressure and sugar control. Sugar control, sugar control, and sugar control. Measure your blood pressure regularly and keep it in check. Apart from these, tobacco and cigarette smoking cessation is absolutely important. Tobacco and cigarette are a poison to the body. Smoking slows the blood flow to the kidneys. Nicotine induces narrowing of the arteries to the kidneys. Apart from this, weight reduction is absolutely essential. Those who are overweight should consider for regular exercise. Simple measures like walking for 30 to 45 minutes daily, yoga will always help. Always remember, excess protein intake can sometimes be harmful for the kidneys. Take a balanced diet rich in good proteins, nutrients, and vitamins. Stay active and healthy. Salt restriction in diet and say no to processed food. Avoid taking over the counter painkillers, long standing anti acidity medicines, painkillers all hamper kidney function. Regular health checkup, preventive health checkup can help pick up kidney diseases in early stages. Avoid taking unscientific or alternative treatment as it can be life threatening as well. The dictum, prevention is better than cure, should always be ingrained in our minds and in our daily lives. Our health is in our hands. On behalf of the entire NU team, we wish you a happy World Kidney Day. Stay safe and be healthy. Thank you.